everyone. Today I'll be reviewing the historical outbreak of HIV/AIDS, specifically in the United States during the 1980s. So first I'll review what HIV/AIDS is and the stages of it, and then I'll give a brief historical background about the early days of the outbreak and where the initial outbreaks occurred. So human immunodeficiency virus, acquired immunodeficiency virus or syndrome is also known as HIV/AIDS. And there are three main stages to it. So the first stage is acute HIV infection. This develops about 2 to 4 weeks after being infected with HIV. So this is the incubation period. People often experience flu-like symptoms. And during this time, the infection multiplies and spreads rapidly, and it attacks CD4 cells, which are infection-fighting cells. So it really is attacking the immune system. And there's a very high risk of transmission during this acute infection stage. And then the chronic infection stage occurs. So this is also known as the asymptomatic stage of HIV. So a lot of times people don't experience any symptoms during this stage and they feel fine, and it can last several years. However, during this time, the cells are the infection is still attacking cells and they're still multiplying just at like a lower level. And during this stage, antiretroviral therapy can help prolong it and lower the viral load, but without it, that's typically where people will start to develop pretty serious cancers, other diseases that are the result of like a weakened immune system. And then the final stage is AIDS. So this is the most severe stage and it's the end stage. This is the result of the immune system being severely damaged by the infection, and the body is no longer able to fight off infection. And it's diagnosed if the CD4 cell count is less than 200. And during this stage, people have a high viral load and a high risk of transmission. And the survival time is about 3 years max. So a little background about HIV and where they think it comes from. So in the early 20th century, HIV-1, they believe it jumped from chimpanzees to humans in Central Africa. In 1959, a man died in Congo, and his blood samples showed that his death was the earliest of confirmed HIV. And then also in the 1960s, HIV-2 jumped from monkeys to humans in West Africa. And then it's believed that HIV-1 arrived in America during the late 1960s. In 1980, Ken Horn, who was a gay man living in San Francisco, was diagnosed with Kaposi's sarcoma, which is a rare and aggressive cancer that is often the result of a weakened immune system. And then he died in November 1981, and he was later identified as the first AIDS patient in America. And then in the summer of 1981, there was an outbreak of rare lung infections and Kaposi sarcomas in young, otherwise healthy gay men in the Bay Area. So this is really kind of what inspired the investigation done by the CDC. So I'm going to review how they investigated during the 1980s, their surveillance, data collection, and the challenges faced. Summer of 1981 is when there were the outbreaks of unusual infections in otherwise healthy gay men, and the CDC used the term AIDS for the first time in September 1982. So that just shows that it was a pretty rapid investigation of it and identification as well. So in 1981, the CDC released an MMWR describing 5 cases of pneumocystis carinii pneumonia, so PCP, among gay men in Los Angeles. And this was the first published report about an illness that later would become known as AIDS. And the report was able to be released in a very timely fashion, actually, because of the work done by the researchers in California at both UCLA and then UCSF. So in addition to that, there were also those reported cases of Kaposi sarcoma, and they were tracking those closely, and those were mostly in the Bay Area. And then the Parasitic Diseases Division of the CDC, Center for Infectious Diseases, had already been concerned about these unusual cases of PCP. And so they also were responsible for administering the treatment for it, because it was just so rare and it was not yet licensed in the US. So it was only available from the CDC. And they had had a lot of recent requests for the drug, for the treatment from like physicians in New York and California who had a lot of sudden influx of PCP patients, but there was no known cause of the immunity deficiency. And this really sparked the attention of the division staff. So after learning about these cases, the CDC formed a task force on Kaposi sarcoma and opportunistic infections, and they began surveillance, and they began to conduct epidemiological investigations. They had a lot of fiscal constraints, and this was really a challenge. But despite that, they were able to form a task force during the summer of 1981 and start to conduct surveillance. So the first thing they did as the task force in that summer was establish a case definition. And they found that the key underlying factor for the disease appeared to be the severe suppression of the cellular immune system. And they were often, they found that oftentimes these diseases were life-threatening and fatal. So by the end of 1981, like a year, 159 cases of sarcoma had been reported, and then opportunistic infections as well. And the earliest cases traced back to 1978. And there was a clear increase in these cases over time. And then following this, so through their close surveillance and their quick acting, they were able to identify that it was a fast acting thing, it was life threatening, and it was highly concentrated. So it was really just occurring in California and in New York City. And then early in 1982, the CDC conducted a national case control study that included most living patients with either the Kaposi sarcoma or opportunistic infections. And the 50 cases among gay men were then controlled to gay men that were matched by city of residence. Oh, I think I'm frozen. Oops, sorry. That were then matched by city of residence, race, and age. And they found that most case patients tended to be much more sexually active than controls, and they were much more likely to have other co-occurring sexually transmitted infections. So following this, they extended the investigation nationwide to include 90 patients, and this was approximately 3/4 of reported cases among gay men at the time. So 40 of the 90 patients across the 10 cities were linked by sexual contacts, with another case patient. So these findings, along with the case control study results, strongly suggested that this new syndrome was caused by a sexually transmittable infectious agent. Nonetheless, scientists were very skeptical of this initial theory. So in addition to the hypothesis about it being transmitted through sexual contact, they also had a hypothesis that it was transmitted through blood, because there had been an increasing number of people with hemophilia and then infants who were showing symptoms or signs of having HIV. And then they also identified needle sharing as a transmission route. And then in 1985, they issued provisional guidelines for blood screening and revised case definitions to note that it does seem to be caused by this newly identified virus. And then in response to people with hemophilia having increased numbers of the HIV infection. And then in 1985, the US Congress allocated $190 million to AIDS research. And the CDC released a report showing that there was an 89% increase in AIDS cases, new incidences from 1984 to 1985. And then I'll also review this later, but then the Surgeon General released a education campaign basically and messaging about HIV. So because of the early surveillance done, they were really able to respond quickly with what they had, especially considering they had limited funding and like limited numbers to conduct the surveillance and case control studies in the beginning. So as there was an increased number of like infants and people with hemophilia, there was the hypothesis that it could also be transmitted by blood. Because they had such good early surveillance efforts with those initial AIDS cases, they were able to respond to the best of their abilities to the epidemic with guidelines. And so through the end of 1982, people were still kind of struggling to understand this disease and like what exactly characterized the risk of this infection. And then in 1983, there's meetings that took place where they were able to, I guess, decide the role of blood in it, meet with people like who ran blood banks and like manufactured blood products, regulatory agencies to try to, I guess, make it as safe as possible, because it was hypothesized that people with hemophilia were getting it from blood transfusions. And so during all that time in March of 1983, the CDC kind of went off these hypotheses and released guidelines based off of the guidelines for hepatitis B, and then ended up being pretty good hypothesis. And so they used their data to kind of show like these are our recommendations for like healthcare workers and like scientists that were working with the biospecimens to just reduce the risk of transmission. And all the while from like 1982 to 1985, the research on AIDS led to the isolation of the virus and the development of a screening test. So they also were able to issue universal precautions to try to control it in the 80s. So this included like glove procedures, waste management, protective barriers, biospecimen management. And then, like I said, they had been developing blood testing through isolating the infection. And that was really critical to being able to provide a screening test to identify cases of HIV. Also, they had a really widespread and collaborative prevention campaign. So the Surgeon General, the Surgeon General in 1986 issued the Surgeon General's Report on AIDS, and it had he called for a comprehensive program of sex and age education. He urged the widespread use of condoms and like sex education in schools. And then he also dispelled a lot of myths, such as like HIV can be spread by mosquitoes, because there definitely were a lot of myths, a lot of stigma. And that continued through the 90s. It's still prevalent. And then in 1987, the CDC launched an unprecedented national campaign called America Responds to AIDS. So they really were trying to increase awareness and understanding of AIDS and prevent infection. So they were encouraging people to seek out more information, counseling, screening, and they also were like encouraging safe sex, and they were working with a lot of like organizations that promoted the welfare of like minoritized populations in order to reach communities that had been especially affected by AIDS, the AIDS epidemic, and get information to them and get prevention services to them. Another part of it is, so in March 1987, FDA approved the AZT, so the first antiretroviral drugs for the treatment of AIDS. However, it was very expensive, and so a lot of people weren't able to access it. Following this, Congress authorized $30 million in emergency funding for the United States for states to pay for low-income patients' treatment of AZT. And this was a precursor to the AIDS Drug Assistance Program. And so that was a big step in helping like provide at least something for treatment, and it was able to somewhat slow viral replication and disease progression. So that was kind of an overview of the 1980s when the big outbreak was initially. And now I'm just going to kind of cover the epidemiological facets and parts of the disease transmission, risk factors, and like susceptible populations. So this really shows the like incidence rates over time. As you can see, there's a large spike in like the mid 1980s, so like that 1984 to 1985 period. And since 1988 to 1990, the new incidences has decreased by 93%. In regard to like deaths, new instances, and number of people living with HIV/AIDS in the United States, so this only goes till 2019. But nonetheless, as you can see, there's been a big increase of people living with HIV/AIDS and a significant decrease in deaths from HIV/AIDS, which shows, the effects of being able to get prevention, get our drugs out, and help prolong people's ability to live with it. And there was a steep decrease in it in like new cases, and then a slight increase across the 2000s, and that's largely because of the opioid epidemic. So just to kind of review the main transmission routes, sexual contact with a partner with HIV, needle sharing with a person with HIV, blood contamination, and then mother-infant birth, or like through breastfeeding, if the mother has HIV. And this shows the like main transmissions. So much of new incidences are accounted for by male-to-male sexual contact. Following that, it's heterosexual contact, and then injection drug use, and finally male-to-male sexual contact and injection drug use co-occurring. Big risk factors of transmission include infection during or transmission during that viral load period. So acute infection, or then like that final stage of AIDS when the viral load is very high, and unprotected sex, other sexually transmitted infections like having STIs in addition to having HIV, or having an STI and having sexual contact with someone with HIV, sharing needles with people, and then alcohol and drug use in the context of sexual behavior. In regard to population susceptibility, so this shows that gay and bisexual men are the population most disproportionately affected by HIV in the US, and this is exacerbated by racial inequities. And as you can see, there was this large spike in like the 1980s and the 1990s, and it has somewhat decreased and then kind of started to increase again in the early 2000s. And then initially rates were highest among white people, but then as you can see, rates started to increase in the 1990s amongst Black people. And since then, Black people have experienced the highest rates due to systemic inequities. So like access to quality care, access to treatment prevention. And yeah, I mean, the resources are out there, but people have to have money, health insurance, et cetera, in order to access them. So that has really created this large disparity. Another disparity or susceptibility is drug injection. People who use drugs, and this kind of shows the categories that are most susceptible to that, or who have had HIV transmission through drug injection. So it's mostly amongst white people, and then like young adults aged 25 to 34. So because of the opioid epidemic, following the great restriction of opioids in response to the opioid epidemic, there was a large increase in heroin use. With heroin use, oftentimes comes needle use, injection. So people, when you share needles and people have HIV, it obviously increases the risk of transmission exponentially. And so that's kind of why we've seen somewhat of an increase in the 2000s, or I guess a return. And this kind of shows that amongst that, men and then gay and bisexual men are at the highest risk amongst people who do inject drugs. So for future directions, there is a lot of research looking at long-acting retroviral drugs, Also looking at developing multiple antibodies for the treatment of HIV, looking at developing a vaccine that would promote sustained viral remission, continuing to promote like PrEP drugs, and do like public education campaigns, and then also addressing health inequities and increasing access to prevention, testing, and treatment.